Hi, I'm Dr. Sujata Rathod, practicing at Cure Hospital, Hiranandani Hospital, and at my center at Vartak Nagar. This is an extension or culmination of the series of videos which I had started, which included the first trimester, the second trimester, and today I am going to speak about the third trimester of your pregnancy. What are the various changes which happens in your body? What are the various changes which are happening to your baby? All this I am trying to cover in this video. Welcome to your third trimester. Your third trimester is the final trimester of the pregnancy. It extends typically from 28th week to 40th week. Say from the 7th month to the 9th month of the pregnancy is considered to be the third trimester of the pregnancy. Now, by week 28, your baby is weighing around say 1 kg or so. It is well developed. If this baby were to deliver at this stage of life, it has got a 50% chance of surviving with a good NICU setup. So it is a stage where the baby has reached its viability. Now this baby is a bundle of flesh, blood. It has got distinct movements. So from around 28th week to 32nd week or so, you feel strong fetal movements. You perceive a lot of movements starting from 28th week onwards. The third trimester is a landmark phase of your pregnancy. The reason being that now the baby can perceive quite a few things. It can hear you, it can hear music, it can hear vibration. This baby is alive and kicking inside. You all must have heard the story of Abhimanyu and the secret of Chakravyuh, which he had heard in his mother's womb. This story is truly amazing because the same thing is happening in your womb. Now your womb is your baby's classroom and you are its teacher. All the emotional centers, the center of happiness, the logical thinking, everything is being laid down in the third trimester. So henceforth, you and your partner are going to be the teachers of your unborn baby. You are going to nurture this little angel inside you and you are going to present it to the world by the end of 40th week. By 32nd week, your visits to your obstetricians are going to increase. She is going to start calling you every fortnightly. There will be few investigations which will be done at the 32nd week, that will be including your hemoglobin, your thyroid, your urine and your blood sugars. By 32nd week, an ultrasound, that is an interval growth ultrasound, will be done. This ultrasound is very important because it now gives you the weight of the baby, which by 32nd week is around 1.4 to 1.6 kg. It also gives us an idea about the liquor, that is the fluid which is present around the baby, through which the baby gets its nutrition. Now the importance of this ultrasound is that if the baby is a little low weight or if the liquor is a little on the lower side, your obstetrician can very well take some steps to correct this. Now by 32nd week, you will also be getting your vaccination, that is your dose of Boostrix. Few complaints which come up in the third trimester. The main complaint which most of the pregnant females come to me saying that they have a lot of backache, they have a lot of heaviness in their lower legs, they have tingling sensation in their lower legs. There is a sharp shooting pain in some of the pregnant women which starts from the lower end of your buttocks and extends up to the end of your legs. This is also known as the pain of sciatica, and it is because of the pressing of the sciatic nerve because of the growing uterus. So this can be relieved by doing few stretches, by taking a warm water bath, by doing few massages, exercises, yoga. This can definitely relieve your lower leg pain. Even the backache which happens in the third trimester, it's because of the extension of your spine. Your protruding abdomen is hyperextending your spine. the bones of your body are being loosened because of the pregnancy hormone. So the backache is the most common complaint which most of the pregnant women come to me, and it can again be relieved by certain local application of creams or a hot water bag or cold fermentation or yoga or stretches. Other very common complaint which is encountered in the third trimester is constipation. Now there are multiple reasons for constipation. Constipation can be because of the multiple supplements you've been taking, the calcium, the iron. Constipation also happens because the pregnancy hormone slows down your intestinal activity. So there is constipation, you find it difficult to pass stools. Now, how can you counter this constipation? You can do so by increasing your hydration. Throughout pregnancy, once your first trimester gets over, be very careful with your hydration. Hydrate yourself well, at least 12 to 14 glasses of water daily, which will also include fruit juices, buttermilk. All this will go a long way in relieving your constipation, in relieving your dehydration, in keeping your skin soft, supple, smooth. If the constipation is too much, then your obstetrician will definitely give you certain stool softeners to help you relieve your constipation. But remember, please do not strain at stools, because this may lead to hemorrhoids or bleeding from your anus during pregnancy, which can be quite troublesome and irritating. Next comes the complaint, most common complaint which I come across is that, doctor, we had been using a lot of creams and lotions to reduce our stretch marks, but see, finally at the start of 32nd or the 33rd week, there are a lot of stretch marks which are seen. Believe me, these stretch marks are going to fade once you deliver. They are not going to go away completely. Obviously, it's a sign of motherhood. You should be proud of them. But yes, if you maintain your dehydration, yes, if you see that you have been applying proper lotions or creams or moisturizers all throughout your pregnancy, your stretch marks will be relieved to a great extent. Sometimes because of the excessive stretching of the abdominal skin, you have a lot of itching over your abdominal skin. In fact, some of the patients have got generalized itching all over their body. Now this generalized itching is because of the slowing down of the liver enzymes. So this can be taken care of by giving certain drugs. Your doctor will definitely help you. The generalized itching can also be reduced if you reduce the temperature of bathing water, if you do not keep AC on for a very long time, maintain your hydration. This all is definitely going to help you. Another complaint which is commonly told to me is feeling lightheaded. Whenever the pregnant patient lies down and she tries to get up from the lying down position, she feels very lightheaded. Now the reason is that the uterus, which has grown in size, is pressing on the major blood vessels which are traversing below the uterus. The heavy uterus presses over these arteries, and therefore the blood supply which is going to the brain reduces. So it's very important that in the third trimester you keep a watch on your position of sleeping. Try to sleep on the left lateral position. This lifts the weight of the major arteries. It improves the blood supply going to the brain. It improves the oxygenation. Now comes the complaint of chronic pain in the legs or tingling sensation. This is known as a restless leg syndrome. This can be relieved by taking calcium supplements in the night, or you can even have a glass of warm milk. Now coming to a very important part in the third trimester, that is your exercise. I have even told you in the earlier videos also, once your first trimester is over, start exercising regularly. Do not get into any fancy exercise mode. You can do the exercises which you have been used to doing it earlier, or else you can take the help of a professional antenatal exercise physiotherapy classes, wherein you are taught few exercises which you can do it at home. In fact, even in this pandemic as well, I have got a lot of patients of mine who were in touch with the physiotherapist and who were taking online sessions with them. These exercises help to keep you very flexible, they keep your weight under check, they help you to lose the pregnancy fat once you deliver, and if you are going for natural labor or normal labor, they help you a lot in even delivering because they retain your flexibility. When I am talking about exercise, a very important exercise which all pregnant women have to do is the Kegels exercise. Now, what's the Kegels exercise? Kegels exercise is specifically meant for it's an exercise of the perineum. What is your perineum? Perineum is the lower floor of your lower floor, which has the urinary bladder, which even has the uterus, which has the rectum. So these perineal exercises strengthen the perineal muscles. They help you in your natural birth process. Now, what is Kegels exercise? Kegels exercise is, imagine trying to hold your urine. You hold your urine for 4 seconds, release it. This you can do it for say 8 to 10 times, and this you can do it for 6 to 7 times a day. Wherever you are, you can do this Kegels exercise. They will really help you in a long way. By around 34 weeks, your baby is almost 1.8 to 2 kgs. 2 to 2.1 kg rather. It's quite heavy, it's moving a lot, it's kicking you. That's the reason why you will have a lot of pain near your ribs, backache. This can be relieved by ice fermentation, few stretches, sleeplessness, anxiety. These are the various changes you start having from 34 weeks onwards. Coming to the sexual drive in pregnancy. Sexual drive in pregnancy, in some patients, yes, it increases, but in many patients it reduces because of the anxiety, because of your weight, because of the weather. If it's very hot, you are just not able to cope up with the increasing weight. So it's very natural to have reduced sexual drive. But yes, you can still enjoy intimate moments with your partner and you can enjoy the pregnancy with your partner. Another complaint, some patients come to me saying that they have excessive hair loss, but 90% and more of the patients, they say that their hair and skin texture improves. The reason being that you've been taking a lot of supplements, you are in your optimum health, so definitely the hair loss is less. Some of them have good hair growth, but along with the hair growth, there is hair growth in other places like on your breast, on your abdomen. You can definitely go for certain hair removal treatments, but I would advise that stick to just waxing and tweezing because your skin is very sensitive. Don't go for treatments like epilation or laser or any chemical treatment. No chemical treatment is permitted during the pregnancy. At the same time, women ask me, Doctor, can I color my hair? Yes, definitely you can color your hair. If you are okay with the natural colors like henna, you can go ahead and use that, or else you can use the ammonia free hair color, which is quite safe in pregnancy. You have now reached your 36-37 weeks. You started feeling a little breathless, shortness of breath. डॉक्टर कुछ भी करती हूँ तो सांस फूलती है. Yes, it's very common. Shortness or breathlessness is common because your chest the diaphragm is moved up, the space which is there for your breathing reduces. Moreover, the circulation has increased by almost 30 to 40%, so you start feeling very flushed. But if any of these complaints are accompanied with chest pain or constant dizziness, then yes, definitely you should get in touch with your doctor. Another common thing which many of the women say that from 32nd week onwards or in the 3rd trimester, they start feeling painless contractions. They are known as Braxton Hicks contraction. They are a way of preparing, your body is preparing for the process of labor which is going to happen after 6 to 8 weeks. These are generally, they are painless, they are non-rhythmic, and they come at irregular intervals. But if they come very regularly, if they are causing pain, if they are very rhythmic, then you should talk to your doctor. Now coming to the breast changes, your breast starts becoming very heavy. You can see engorged veins on your breast. The nipples become more prominent. The areola becomes more prominent. You can see few glands over your nipples. This is your body's way of building up the breast or preparing the breast for the breastfeeding which is going to happen. But sometimes in the third trimester, you may see that you are leaking from your breast. This is a very common sign which happens in the third trimester. Don't worry about it. Do not express the liquid, just use a breast pad, and the embarrassing moments which you face because of the staining of your clothes can be taken care by the breast pad. Now coming to leaking, there is some amount of vaginal discharge also which increases in the third trimester. Obviously your vagina is getting stretched, the glands are overactive, so you may feel a constant wetness. If it is too much, you are going to talk to your obstetrician. The wetness should not be the one which causes itching or should not be a foul smell discharge. If it's a normal sticky discharge, you can use a panty liner throughout the day. That way you will be very comfortable. But if it's in the form of a gush or a trickle, then yes, you should speak to your doctor and you should confirm that there is no leak or there is no rupture of your bag of membranes. So you should be a little careful. Somewhere in the 36th, 37th week onwards, you will feel that suddenly your baby movements are a little less. The reason is that the baby has grown almost to the size of 2.2, 2.5 kg, 2.2 to 2.3. Now the baby does not have much space to move around, it's just going to wriggle. So the movements which you were feeling very strong in the 32nd week, they are going to reduce. If you give this complaint to your doctor, obviously she is going to ask you to keep a daily fetal kick count, and that can be kept for say around 2 hours a day, and you should expect around 8 to 10 kicks in those 2 hours. So remember your baby, you shouldn't expect your baby to be active 24/7 because this baby also has sleep cycle. So this baby is going to sleep quite a lot in your womb, so don't expect that your baby is going to kick all throughout that 24 hours. It's going to take rest as well. Now you have arrived in your 37th, 38th week. Your visits have become weekly. This is the time you should now prepare your baby bag, because any time you can go in labor. Maybe it can come a little early in some women. So talk to your hospital wherever you have registered. Ask them what they are going to provide the baby in when you are going to stay with them. Ask them what they are going to provide to you, the maternity gown, the diapers, the maternity pad, and accordingly pack your baby bag and keep it at a place where your partner knows where to pick up from. Keep all your papers and your reports handy, so in case if you have to rush, the family members know where to pick it up and go. If you have registered for the stem cell, then this is the time when you should keep the stem cell kit at home. So if you have to rush to the hospital, you can carry the kit along with you. By around 38 weeks, your obstetrician is going to sit with you and explain to you all these signs as to if you go in labor, what you should expect. What kind of labor pains will come, what happens if there is leaking, what happens if there is reduced fetal movements. All this is definitely going to be explained by your obstetrician to you. Whatever, my advice to all you young ladies is that whatever silly questions you have, you feel they are silly, but they are not silly, they are your queries. So every time you visit your obstetrician, maintain a small diary and write your questions and be very frank with your obstetrician and ask all your queries, solve them. Remember, she is going to be your guide, she is going to be your friend for these 9 months, and she is going to help you to deliver. So please be free with her. Instead of taking a lot of unsolicited advice which you get from lot of women, be your neighbor or be your friend, and these unsolicited advice can land you in trouble, it's the best thing to do is to talk to your obstetrician and solve all your queries. This is a time when you should even decide that if you're going to go in for your natural labor or your normal labor, who is going to be with you in the labor room. It does not necessarily mean that it has to be your husband, it can be anybody with whom you are comfortable with. The person who is going to be with you in the labor ward should be the person who is very calm, who can prep you, who can give you some good talk, who can massage you, who is on his or her toes during your entire process of labor. The person who is going to be with you in the labor ward should make you comfortable. It should not be somebody who goes hyper, or who becomes hyper, or who needs resuscitation by the other members of the labor ward. So decide, it can be your mother, your mother-in-law, your friend, your husband, whoever makes you comfortable should be the person who is there with you in the labor ward. Now, somewhere in the 38th week, you can even speak to your doctor about epidural analgesia, that is labor analgesia. That is, if you want to opt for painless delivery, you should talk to your doctor, and if preparations have to be made for it, you can inform your doctor about labor analgesia. Now, along with a lot of physical, mental changes, there are a lot of emotional changes also happening. You're very anxious, you're very tired, you're very unhappy sometimes because of the body image which you are seeing. All this is going to work you up. You're going to be very anxious. Keep talking to your family members, see that you have your loved one near you. Now in this pandemic, sometimes it's just you and your husband who are going to go through this labor process all alone. So before your D-Day arrives, take care that if it's only you and your husband, then make all preparations for your baby, say be it the baby's cradle, or be it the baby's nursery, or be it stocking up your kitchen. Everything should be done before you enter your D-Day, because once you come back, you will be so much held with the baby that you will not get time to look into all these things. Somewhere by around 38th week, 39th week, you can pamper yourself. You can go for your haircut, you can go for your manicure, pedicure, do everything which you want to pamper yourself, because once you come back with the baby is going to be your world for the next few months. Now, the D-Day has arrived, you've rushed to the hospital, your obstetrician is by your side. Be extremely calm. Remember all the prayers and everything, and just be in tune with your divine. You are in a phase where you are going to deliver this beautiful angel. You have nurtured it for the 9 months, and now it's the time to present it to the world. You are going to be a mother. They say that it's said that the motherhood or becoming a mother is a second life which we are getting. Yes, definitely it's a second life we are getting, because the baby is going to change your life forever. You are going to be a completely different person altogether, emotionally as well as physically. So all the best for your motherhood, and I hope all these 3 videos, including my first trimester, second trimester and the third trimester video, has helped you. I am reachable on the below given centers, and if you anytime feel like consulting me or getting in touch with me, you can please reach out to me. Thank you, and all the very best for your pregnancy journey.